Sexologists from Samadhan Health Studio bring to you a refreshing podcast, My Doctor Tells. Here you will find solution to all common sex problems directly from the experts. Know about vaginismus, unconsummated sex, erectile dysfunction, premature ejaculation, masturbation addiction, nightfall, and truths about several sexual myths. I am Dr. Ashok Koparday in association with Dr. Hetal Gosalia, and we have made all of this and much more available to you all for free. No strings attached, no sign-ups, no email IDs required at mydoctortells.com. I will tell you something very interesting and not uncommon. A couple comes to us, they are highly educated, intelligent, working professionals of a very high executive caliber who are reporting to us, who are telling this to us, that we are married for 2 years and we have not been able to do sexual intercourse. We love each other, but this thing is not happening. Here, she is a typical girl and she is quiet, and then she speaks and she says that I have a little fear and I am afraid of the pain, because when there is an attempt, see, we do everything, we love each other very much, everything, kissing, touching, everything, the foreplay is so beautiful, but now when he does the insertion aspect, I get pain and I'm really scared about it, so we don't know how to go about it. And this man has been very kind to me, he understands, he doesn't force upon me, but we kept on trying, and now what is happening is, it's been 2 years, our second anniversary is already over last month. Now I'm not enjoying sex, I'm not, that foreplay etc which we used to enjoy, that's also not happening. So what is this couple saying? This couple is saying, she's saying especially, that she is afraid of sexual insertion. She is afraid of the penetration part of the sex. And is this rare? No, this is not uncommon at all. Only thing is, most of the couples take about 2 years or 3 years to walk into the doctor's office, and they pull on, and only when there is a pressure about news, and there is an urge that they have to have a baby, that they break that barrier of inhibition of going to a sexologist, and then they walk to our office. What is happening? Why is she afraid of pain? Initially I used to ask almost all the girls, what had you heard about sex, and what do you, so she would say, she very honestly, she says that I have been told by my relative, she's already married, so she said that there will be some pain initially when you do sex, there can be some bleeding also, but later on it becomes easy. So she's already been told that there can be pain, there can be some bleeding by either her best friend who's already married or by a relative. So she's anticipating pain. So what is happening in her case is that the vaginal muscles, the opening of where the penis is supposed to go in, that the vagina, the opening of the vagina goes into an involuntary spasm. Please understand the word involuntary. When he is attempting to insert, this opening goes into a spasm and contracts, and it doesn't let the penis go in. I'll give you a simile, I'll give you just to understand an example. Let's suppose a baby is keeping its mouth very tightly closed and you want to feed the baby. And if you are feeding the baby and the mouth is tightly closed, the lips are tightly closed, and you try to force something, there's going to be pain and the baby will bleed from its lips. So the pain and bleeding comes because the opening, the vaginal opening is closed. So if there is a relative who has told her that yes, in my case I had some pain or I had some bleeding, so is she lying? No, she is not lying. She really had pain because she was afraid, because this was a new experience. She is inexperienced, she is virgin, and she thought that this something huge is going to enter inside, so it might pain, and so it really pained her. And when she has communicated this to this young lady who is coming to us after 2 years of her marriage, she is anticipating pain, and then this always goes into an involuntary spasm. So please understand the anatomy. This is the vaginal, the vulva or the external, female external genitals are like this. There are two major lips. These lips are called as the labia majora or the major lips. When you separate them, you will find two inner lips. These are called as the labia minora. So these are the inner lips. When you separate them, then tiny inside is a hole which is called as the vaginal opening. Externally you wouldn't see them. This is flushed with, this is the vulva. These are the external female genitals. So here what I am trying to stress is that the vagina is very difficult to locate. It is hidden between two fat folds of fat, pads of fat, which are called as the labia or the lips, outer lips and the inner lips, the labia majora and the labia minora. So suppose there is a sexual intercourse happening this way and she is lying down in the missionary position and he is on top. This is her face, this is his face. Now how is he going to know where the penis is going inside? So the penis is hitting here and there, and by the time he is attempting insertion, because of his excitation, there will be ejaculation, there will be a discharge, and he will not be able to get a second erection quickly. So this is how he may label himself as, I am having difficulty in sustaining erection, I am having ED, or he may label himself as, I am having premature ejaculation. But here, when you ask specifically a question, does she experience pain? Has she expressed that I am afraid? Is she pushing you? We also get cases where after 2 years, this couple or the girl along with her mother walks into a gynecologist's office and they go to a gynecologist clinic. The gynecologist, as per the routine, she does a per vaginal examination. What is a per vaginal examination? It's a medical term. By that what we mean is the gynecologist wears sterile gloves and inserts 2 fingers in the woman's vagina and she palpates and she feels. So this is a routine procedure for a gynecologist. And there is a per speculum examination in which there is a steel instrument like this which is inserted into the vagina so that the gynecologist can observe the opening. This is a routine procedure which a gynecologist does. It's as simple as a doctor puts a stethoscope and examines you when you walk to your family doctor's office. Now this can lead to tremendous pain and an experience of horror, and it can complicate the entire situation, entire condition which this woman is facing. What is this condition? This is a medical condition. I have just explained to you that this woman has walked to us and she is telling that I feel pain, I am afraid of the penis entering inside. This is a medical condition. It is called as vaginismus. I repeat, this is called as vaginismus. Of the number of couples who have come to us, 98% of the couples who have visited a gynecologist have never been told by the gynecologist that you are having vaginismus. They have just carried with them a fear, a horrible fear of anything entering inside, and then their visit to the next doctor, whether it's another gynecologist or actually it has to be a sexologist they should be going into, but usually they tend to go to a gynecologist thinking that it's a female problem and the gynecologist would know. So it takes another 3 years now. So they come, instead of 2 years, they come sometimes after 5 years after marriage. And this is because of the pain that they experience when the doctor is examining. Experienced sex therapist who knows this medical condition called as vaginismus will not touch the woman. He will not do a per vaginal examination. Here we get phone calls when the woman, with a scared, tense voice, she asks us that I want to come to you for consultation, but she prefers a phone consultation rather than meeting us in person. Do you know why? Because she's afraid that we might try and do some physical examination. We might let the gynecologist insert a finger. Please listen to this attentively. The treatment for this case, about which you are horrified, I mean, sex which should be full of pleasure and joy and love and the beauty of it, which is almost cannot be described in words, is something which is painful for you. The treatment for this is very easy, very simple. Please know that it doesn't require us as sexologists to even examine you or put some finger or anything there. We don't need to do that. We don't need to do that. We don't need to use tubes, lubes, anesthetic gels, Lignox and other KY jelly. We don't need to use that. We don't need to use what you might have done some Google search if you are one of the people who are watching this and you have heard what is called as vaginal dilators. So we do not need to use vaginal dilators. What are vaginal dilators? They are metallic or plastic or those type of tubes which are of varying diameters. One diameter will be so thin, the other diameter will be twice this, the third diameter. So there will be about a row of 5 to 6 dilators or tubes which the woman is told by the therapist. But often, most of the sex therapists, they would say that put the smallest, the thinnest inside into your vaginal space. Keep it there for a certain time and then remove it. Gradually, week by week, as you get confident, use a dilator of a bigger size. This is a therapy or treatment using vaginal dilators. We have not used this treatment in this year, the past year, or ever before. We have not been required to use. What I'm trying to say is that what you see on Google search and what you see on Google as part of treatment are redundant, are not necessary. I will not name the famous hospital. It's a 5-star hospital in Mumbai, the financial capital of India, where the woman had undergone an operation. What they do is they take a cruciate incision at the vaginal orifice, at the opening. They take a cruciate incision. The idea is so that the opening becomes wider and then the vagina becomes wider, bigger, and it allows the penis to go inside. This is called as Fenton's operation. Please know that this is outdated. It is useless. So don't go for these kind of procedures. They are not required. So when we tell the girl who is sitting in front of us in our clinic that we do not do these procedures, so they ask us, what do you do as treatment? You'll be surprised to know that what we do is we use words like medicines. Words are our surgical tools, like a scalpel. We use the words and we talk to you, and there is a process of unlearning. There is a process of dissolving this fear. Like ice melts, the entire fear goes away. How do we accomplish this? We do not treat your external genitals, we do not treat your vulva, we do not treat your vagina, we do not use an anesthetic gel there, we do not use dilators there, we do not do surgery there. Brain, your brain is the most important sex organ. Have you ever thought of this? Your brain is the most important sex organ. The brain is sending signals of fear, alarm. So this is going to go clamp. There are tubococcygis muscles on the pelvic floor which go into contraction, into spasm, and so arises the condition called as vaginismus. So vaginismus has a very definite treatment. The success rate is, I'm breaching my modesty, but I will tell you the success rate is 100%, and we don't need to send you for any tests, blood tests, this test, sonography, vaginal ultrasound. We don't need to do this. We don't need to do any tests for the guy, the testosterone levels and all those tests which we see. Usually they come to us with a file, having been to a urologist, having been to a gynecologist, they come with the entire investigative reports. So all these are not necessary, and there is a systematic therapy for this. This is psychosexual therapeutic counseling, and in this method there are steps by which the entire fear dissolves, the pleasure takes over, and the woman who is so scared comes to enjoy sex, and the opening now allows the penis to go inside, and there is a smooth insertion. There is the word penetration, sexual penetration. We do not use the word penetration, and the penis just glides inside, and there is a step-by-step technique. There is a proper guided therapy for this, which gives successful results. There is one thing that I just want to share with you, that over the past 20 to 30 years that we've been practicing, we have had so many cases of vaginismus that we, myself, Dr. Ashok Koparday and Dr. Hetal Gosalia, we have been treating, that those who have overcome this fear, who have been able to enjoy sexual intercourse with their partner, who have been able to conceive pregnancy, natural pregnancy through sexual intercourse, have now come on board with us as a support therapy. So this group of girls and guys, the couple, they sometimes, when required, when the woman is too scared, they come and they directly talk to you, and because they have been sitting where you are sitting, with fear, with pain, fear of sexual intercourse, sexual penetration. They have been afraid of that, and they have gone through the therapy. It is so smooth, it is so painless, and now they are blessed with a child naturally, without expensive, cumbersome infertility treatment. You are blessed with a child, and the joy, natural joy of sex, the God-given joy of sex. This is possible. Vaginismus is a condition which has a definite treatment. Please don't spend a lot of time just thinking when to go to a doctor, should we go to a doctor, and just don't try to evade. Whenever a thing is painful, a person tries to avoid it, and she is already working, he is also working, so they become workaholics. So please don't evade. As soon as you can, when you recognize that there is some pain or difficulty, please meet an expert and meet a proper competent sexologist. This is the only place I know in the world where both the male and the female sexologist work together with the couple. So this is your best bet to get well and get very soon. And we have got a wonderful website which gives you pictures. I'll be showing you the pictures on the screen. These pictures that are, they are hand drawn, but they are drawn to scale. And this picture will show you exactly the mechanism of vaginismus, how it's happening. Look at the pictures. The same pictures are given on our website, My Doctor Tells, my doctor doctor tells tells mydoctortells.com. There is an entire chapter on vaginismus with the podcast, and Dr. Hazel herself has explained this condition extremely beautifully, lucidly. So if you find any couple who is 2 years plus and not having a baby or pregnancy, and if they disclose to you that, or if you find out that they have not had a sexual insertion, then the best thing you can do for them is to encourage them to go to a proper sex therapist, get it resolved, and enjoy the beauty that life is. This is for you.